Welcome to Bangor University and welcome to the School of Health Sciences. My name is Dr. Lynne Williams and I'm the head of the school. The School of Health Sciences offers a range of undergraduate programmes to meet your needs and your preferred career choice. We do also offer postgraduate programmes and we have a range of other CPD activities linked to the school. And also we're very much a research-based school, so we have a range of research groups that work within the school, again promoting health and care for the region and for Wales and for the UK more broadly. We have two campuses, so we have a campus at Bangor and also a campus at Wrexham, so that you get to choose where you want to study with us. So what's the core mission of our school? So what we always aim to do is to mobilise our expertise and experience, find new solutions to health challenges and engage with healthcare research, teaching activities that is of the highest possible standard quality for you as our prospective students. And of course of value to service users, to practitioners, and to all the stakeholders that we work with. Just a few headlines about our school. As I mentioned, we are very much a research-led school. We were in the UK top 20 for health-related research at the last exercise. We've also have a track record in excellence in teaching and learning. Our staff have experience and expertise in a full range of healthcare professional programmes, including nursing, therapies, midwifery, radiography, and so forth. And as I previously mentioned, we do have campuses in Bangor and Wrexham for you to choose where you wish to study. So in terms of our undergraduate portfolio of programmes, you can choose to study with us in nursing, and that's for all 4 fields of nursing. So adult nursing, children's nursing, mental health nursing, and learning disability nursing. You can also choose to study with us our midwifery programme, our diagnostic radiography programme, or our BA health and social care programme. Our research is broad. We have a Centre for Health Economics and Medicines Evaluation. We have a clinical trials unit aligned with the school. We have a North Wales Centre for Primary Care Research, focusing on such issues as prevention. And we also have an ageing and dementia research group. We're really pleased that Bangor University encourages all students to use their Welsh, and broadly speaking, around 2,500 of all Bangor students speak Welsh, and 70% of staff have Welsh language ability. And that is very much reflected in our school and our ethos. We will offer you support to study through the medium of Welsh if that is your desire, and bursaries are available for students studying a number of credits through the medium of Welsh. So come and see us, come and meet us, come and look at our programmes and start making the extraordinary happen for you. Thank you for listening.
Hello, my name is Elizabeth Mason. I'm the Director for Recruitment and Selection for the School of Health Sciences at Bangor University. This short presentation is to provide you with some information about our 4 fields of nursing, so the Bachelor of Nursing degrees that we offer in the 4 fields: learning disability, mental health, adult and child. The important thing to note is that education is field specific, so that means that you need to think about which field of nursing you want to apply for when you're submitting your UCAS application, and which field of nursing you want to register in once you complete your nursing degree in your field of practice. We have adult nursing, which is the broadest of the four. It's not general nursing, it is adult nursing, but it means that you'd be able to work in hospitals, so in the primary, the secondary care setting. You may work in general practice, prisons, schools, the voluntary sector. So it's the broadest of them all, because within each of those areas, there's a range of specialisms that you can work towards once you have completed your Bachelor of Nursing degree in adult field. Children's nursing is similar, but the difference is, of course, that you are working with children and young people. And again, you would work in a range of practice settings very similar to that of the adult nurse. Mental health nursing focuses on aspects of supporting people with physical and mental health of patients with mental health conditions. So you would be working either in the secondary care setting, which is the acute care setting, but also the primary care setting or community setting, where the care for people with mental health conditions is predominantly provided. Learning disabilities is rather different, because you are there to advocate for your patients. It is about understanding their needs as a learning disability or a person with learning disabilities, but also understanding that people with learning disabilities have the same physical needs and physical ailments that other people get. So you need to be able to help and support them and advocate for them when they become unwell. I would strongly suggest you have a look at the Health Careers website, but also this Times Higher Education website as well, that provides you with information about what you can do with a nursing degree. So our curriculum is generic and field specific. So that means some modules are going to be generic, so shared across the 4 fields of nursing. Some are going to be field specific, so where you focus on your particular field. We will have interprofessional learning as well, so shared learning with other allied health professional students. Our course is 50% theory and 50% practice. Now that doesn't mean for the theory 2,300 hours that you're going to be sitting in a classroom for that length of time. What it means is that you will be engaging in a range of learning activities, whether it is a traditional lecture where you're coming in for a lecture face-to-face, or taking part in online learning activities. All of these have to be completed to add up to the 2,300 hours that you need to have completed by the end of the programme. The other 50% of the course is 2,300 hours of practice placement learning. So that you would undertake within your practice placement learning as 50% of the programme. I'll tell you a little bit more about that in a moment. So we have also bilingual education. So that means that you would be allocated to a personal tutor who is either English or Welsh speaking as per your preference. And the same for module supervision. So each module you have bilingual educational resources, but we would allocate you to a bilingual or Welsh speaking person if you were Welsh speaking, and if you weren't Welsh speaking, obviously to an English speaking personal tutor and supervising tutor. This is the footprint for Betsy Cadwallader University Health Board, and we offer a range of community and secondary care placements across this footprint. So we have the main hospitals, Ysbyty Myla at Wrexham, Ysbyty Llanllwyd just outside Rhyl, and Ysbyty Gwynedd just outside Bangor. Now, all of these 3 main hospitals are used for your practice placements, but we also use the community teams and the community placements across BCUHB. We also use a number of private practice placement providers to give you the range of placement experience that you need for your particular field of practice. Thank you for listening. I hope this information has been useful for you. What I would suggest is you come, you have a look at what we offer at Bangor University. You can have a look at our website, and you can come to our virtual open days and be more than happy to answer any of your questions. Thank you.
Hi, my name's Delyth Hughes. I'm the professional lead for radiography here at Bangor University. Bangor University's got a very long history of delivering excellent radiography education. We are based on the Wrexham campus of the university, and we do have links with all 3 local hospitals and some further afield in Chester, Stoke and Aberystwyth, as well as the 3 in North Wales. The course was completely redesigned in 2020. It's been approved by the HCPC and by the College of Radiographers. It includes things like digital imaging, artificial intelligence, health informatics, administration of drugs, commenting on images. We have excellent teaching facilities. We have desktop simulation software. We've got a fully working digital X-ray room, and we do have some immersive virtual reality equipment as well. As I'm sure you've already heard, NHS Wales bursaries are available for students that cover all your fees and give you a maintenance element. They are conditional on you committing to work for 2 years in Wales, and they are available for radiography students. So what will you study in diagnostic radiography? In each year, there are 3 radiography modules and 1 interprofessional module. Across the 3 years, you will learn about anatomy, physics, physiology, sociology, research, imaging practice, obviously. How do I X-ray somebody? Why do I X-ray somebody? Leadership, management and coaching, amongst many other things. How will you learn? We have a range of different ways of delivering teaching here at Bangor. So we will have online tutorials, we'll have in-person tutorials, we have practical hands-on session in the fully working X-ray room, we have sessions in the computer library with the desktop simulation, and we, as I said, we also have the immersive virtual reality with the headset and the hand controllers, and we were one of the first universities, or we were the first university in the UK to get that. A big part of training to be a radiographer is placement. So over 3 years, you will complete 64 weeks of clinical placement, which is a lot. Your university and clinical blocks will both be around 7 weeks. Apart from in the first year, you have an extended university block. So before Christmas, you're in university and then you go out on placements. And we do it that way so that you get a much longer clinical placement, which enables you to settle in and be able to find your feet and get going much quicker. You also can have a 2-week elective block straight after your exams in the second year, where you can arrange to go to a department in a hospital that you're interested in. So that might be a paediatric department or a cardiothoracic unit or any other sort of department that you're interested in. All of our placement sites have got very modern equipment. They give you the full spectrum of experience that you'll need. And as I said, it's 3 BCUHB, which are the North Wales hospitals in Wrexham, Rhyl and Bangor, Aberystwyth, Stoke and Chester. So is radiography for you? To be a radiographer, you need to have a very highly developed interest in science. So physics, biology, anatomy, it's a massive part of the course. But you need to also have that combined with the ability to develop empathy for people. You will be dealing with people who are sometimes at a very, very fragile state. They're waiting for bad news. They're very worried. They're very anxious. So you need to have excellent communication skills. You can't be afraid of hard work. You must be a good team player, and you need to be emotionally and physically resilient. And that's really just a very quick introduction to diagnostic radiography at Bangor University. And hopefully we will see some of you here at the university in 2022, starting your career as a radiographer. Thank you very much.
Hello, my name is Dr. Simon Bishop and I lead the BA Health and Social Care degree at Bangor University. Health and social care is a really important subject area. It's very broad and multidisciplinary. It's social science based, but it leads to a broad qualification in both health and the social care fields. It's a really good alternative to clinical training for those interested in a career in health. The programme is based largely on the social determinants of health. So these are the social factors that we all experience every day around where we live, where we work, our culture, our background, our gender, and how those broader social factors act on the factors that drive our health and well-being. And that's very much the heart of the whole programme throughout all the 3 years. The course itself is delivered over 3 years on a full-time basis and uses a blend of compulsory and option modules. Compulsory modules, particularly in the first year, to give you those core foundations in health and social care, and then option modules later on to give you the opportunity to focus your learning in the direction that most interests you. The variety of modules, such as fundamentals of sociology, a strong sociology module, working with vulnerable populations, so groups like children, old people, migrants, people with not much of a voice, needing an advocate. And for those of you interested in potentially working overseas, global health and social care. There's also work experience available, either on a short-term basis up to about a year, where you can really use that experience to build your resume, to support your academic experience and knowledge. And the programme builds year on year, very incrementally. The second year building on the first year, the third year building on the second, to lead you on a journey through to becoming a highly skilled and highly knowledgeable health and social care professional. Employability is really good in this field. It's a great place to find a great job. About 10% of the UK workforce are employed in some aspect of health and social care. And so with a degree in the subject, it means that around about 10% of jobs in the UK are open to you. It's really up to you what you want to do. Do you want to lead? There are leadership training options available in the NHS or for local authorities and some health businesses, graduate schemes, if that's where you see your future. Alternatively, do you want to work on the front line with vulnerable groups of people, with clients and communities? If you do, that's fine, because the course will equip you with the skills and expertise to do that around understanding health behaviours and health psychology and those very important social determinants of health. Or do you want to specialise? Are you very aspirational? Would you like to maybe train to become a consultant in public health, or train to become a nurse by doing a postgraduate course, a social worker, or would you like to teach? All of these careers are open to you once you have a degree in health and social care. So why Bangor? Well, Bangor is a great place to study. The course itself is excellent. It's very broad-based, covers all aspects of health and sociology. It's got a national and international focus, and is designed specifically to prepare you for employment, to make you as attractive as possible to future employers. The team is very experienced and dedicated to making your time at Bangor the best it can be. The university itself also has a gold award for teaching in excellence, which gives you confidence that the quality of education you get at Bangor will be amongst the best available in the country. Also, Bangor is a great place to live and to study. It's on the edge of Snowdonia, surrounded by beaches, but also the thriving nightlife and community. So you really do get the best of both worlds if you come to study at Bangor. To get here, you need between 80 and 96 tariff points from a level 3 qualification. A-levels, a BTEC access course, and others are fine. Also, if you're a mature student with fewer or lower, or sometimes maybe no qualifications at all, that's fine too, because we value your lived experience. If you want to find out more, then go on the website. If you just go to bangor.ac.uk and type in health and social care, you'll go to the programme web space, and you can read a bit more about the programme there. Alternatively, contact me directly. My email address is s.j.bishop@bangor.ac.uk, and I'll get back to you and hopefully answer all your questions. I hope to see you in September, and I can promise you if you do come to Bangor, you'll have a great time and leave with a great qualification.